Hi, my name is Dr. David Kulla, and I'm here with Synergy Wellness in New York City. We have another case of a hiatal hernia. We have Eric here. He traveled here. I'm in New York City. He traveled all the way from Boston, and he's not the first person to travel pretty far to see us for a hiatal hernia. For those of you that have not seen my videos, we do specialize in hiatal hernias, and we specialize in a non-invasive, non-surgical technique, and it is extremely effective. I don't know what other people are saying or what you've read online, and if you have read skeptics, they're probably surgeons that do the fundoscopic surgery. And this is what I've found. I've looked online and seen threads of people commenting like this is BS, this is a nonsense manual therapy technique, and when you look into it further, those people are surgeons. So they have an axe to grind, and it's awful. As a surgeon or as a doctor, period, if something is helping people, then you push those people towards that conservative help first before you do surgery. And unfortunately, a lot of doctors have really big egos, and they don't do that. They're quicker to do the surgery, which once it's done, that's it. Okay. So again, if you do meet a doctor and he's open to you having this technique done and, you know, helps you seek someone out to have that procedure, this non-invasive procedure done, then he's the right doctor. He's doing it for all the right reasons, okay? So unfortunately, egos get in the way and prevent people or people that are considering surgery or candidates for surgery. He really, the physicians tend to prevent people to seek out other alternative methods, non-surgical methods. And you have to exhaust all non-surgical methods before doing surgery, always, with any condition, with any case. Unless it's something, you know, an emergency and needs to be operated on right away, of course. So Eric is here for 3 days. He has...
This is my second day.
Yep, this is his second day. So we saw him yesterday. He had some really intense symptoms. Some of them being that he's lost weight recently. He can't really eat, doesn't have much of an appetite because it bothers him to eat.
And also, you know, I'm just afraid of eating too much. And then,
Your food comes up after a while?
The thing is, you know, I feel like if I eat too much and then if the pressure in my abdomen gets bigger, and then it will cause shortness of breath.
Okay, so that's the bloating, and then he feels shortness of breath, and then he gets acid reflux, right?
Yeah, especially when I lie down. Acid reflux.
So so we saw him yesterday, and first off, were you able to eat a full meal?
Actually, yesterday? Yeah, after first treatment yesterday, with my family, we went to a restaurant, and I had a good amount of meal, so I was happy to have.
Did you have acid reflux when you laid down last night, or did you lay down propped up?
I actually, as usual, I'm still afraid of lying, flat. So my head was a little bit heightened.
Okay. So we're probably going to do a follow-up video if he's okay with it tomorrow, because I'm going to see him tomorrow, 3 days in a row. Yes. He's only here for a couple days. But tomorrow we're going to do a follow-up video, and I'm going to ask him tonight to lay down flat and see how he feels. See if he's able to do it.
Experiment.
Yeah, and then obviously go ahead and have a nice meal. It's New York City, some great restaurants here. And then tomorrow we're going to do the same thing, and then we're going to send him home with a tool, a hiatal hernia self-help tool called the Hiatal Hernia Hook. But we will be following up with him, tomorrow, and just so you guys can see 3 treatments in a row. And he did wake up today, though, feeling the belching and the burping and the difficulty breathing again, right?
Yes, sir.
Yeah, so he has some postural issues. We need to work on his kyphosis, his bent over posture. We're working on that. That will take time.
Because I've been using computer like all day long, and
Yeah, so he slouches, sits in front of a computer.
almost all the time.
But the good news is that we had changes after one treatment. And when a patient tells me they've had significant changes in one treatment, we know at that point that they're going to have really good results with the reduction in their symptoms from a hiatal hernia. So that must be relieving to you, because he was pretty desperate when he came in here yesterday, and I can understand. So, you know, it's an uncomfortable condition that people have to deal with hiatal hernia. I have a hiatal hernia, but I am not symptomatic. I had one bout of acid reflux, and I had used my tool once, but that's a unique case, okay? And I'm also always working on my posture, and I have a strong diaphragm. So in the end, we're going to need to strengthen his diaphragm and improve his posture. And the tool that I sent him home with will actually pull the stomach down and correct the hernia. And then he'll be doing diaphragmatic exercises as well as postural reset exercises to make sure that this doesn't come back ever again. Okay, so let's go ahead and get started with you. I'm going to have you pull your shirt up, and I'm going to put the microphone down here on his stomach so you guys can hear the sound. So if someone is doing this to you, or you're trying to do it yourself, or maybe you're going to get the self-help tool that we made once it comes out on the market, you'll be able to know and recognize that sound. And we didn't hear it so much there. You'll hear like a gurgling noise.
I'm feeling something inside. But
You felt it, but you didn't hear it. So I'm going to be quiet again, see if we can hear it. And again, I could feel it moving underneath, but we didn't hear that.
Actually, I feel like some bubbles popping inside.
You do, okay. I don't know if you folks could hear that. We have the microphone right set on his stomach. It's not very loud. Sometimes
Actually, my stomach is a little bit full now. And
Is it?
Yesterday it was pretty much
empty.
Yeah, now it's full. Yeah, just after breakfast.
That's okay though. There you go. You heard that, folks. It's like a gurgling or a bubbly sound. That is perfectly normal when you hear that. Don't be alarmed by that. Let's see. We're going to do one more pull down here. Good. Okay. Now what we want to do is adjust your thoracic spine. So I'm going to have you turn over on your stomach. So the reason why we want to adjust the spine is the stomach is attached to the spine via the anterior longitudinal ligament. So posture has everything to do, scoliosis has a lot to do with hiatal hernia, but not every case, some cases. So he's very hunched over through here. So we're going to adjust T6 through T9, which is nerve supply to the stomach and the diaphragm. And take a deep breath in. Good, and blow all the way out. And on your back. Then we also want to check the middle part of the neck, which is a nerve supply, vagus nerve. Were you able to get a towel to
Yes.
roll up? Okay,
Yes,
great.
I put in my bag.
Great.
While I'm driving.
Relax here. Oh. Okay, roll onto your side and come on up that way. So folks, we're going to follow up with him again tomorrow, and we'll have done 3 visits in a row. It's not something we typically do. He's going to be a little bit sore, his stomach, but we're going to follow him through 3 days and just see how he's doing, so you folks can see how he's doing. These are not paid actors, of course. These are real patients with real problems, with real results. So there is hope for you. If you do have a hiatal hernia, don't give up. There is hope, and there are non-surgical methods that can help. Thanks for tuning in. Hang tight though, because we're gonna have day 3 right after this here. Hello everyone, so here we are, day 3, as I said, and as I promised, we're following up with Eric. Now we are on we've had 2 treatments, right? Today's our 3rd. How are you feeling at this point?
A couple of things in terms of breathing, it's pretty much the same as before. However, belching, like burping, reduced, like I would say like 30%, maybe 40%.
Okay.
Especially after the meal. Before I came here, after every meal, I used like burp like a lot. It diminished by 40%, I would say.
Okay, 40%.
Yeah, and last night, as we talked yesterday, last night instead of like 2 pillows, I used only 1 pillow, and I could sleep.
You could.
But at this point, I should also say that around like 9 p.m.-ish, I stopped eating and drinking.
Okay.
And then, because I was staying over with my friend, so I went to bed around like midnight.
Okay.
12 a.m.-ish. So 3 hours after I stopped, eating and drinking. And I used only 1 pillow. And I slept on my back like much better.
You said 1 pillow, not pill, for those of you
pillow.
that might not have heard that.
Like pillow.
Yeah.
Because before I used to have like 2 or more.
Okay.
Most like 45-degree angle, so that,
Okay.
all those stuff in my stomach doesn't, cause me like coughing and stuff.
And the acid reflux.
Yeah, acid reflux, absolutely.
Okay.
So,
Did you have acid reflux last night?
I would say no,
Okay.
but I still wanted to use kind of a little bit high pillow. It's not like
Sure.
slim. But
Okay.
I used 1 pillow, and I slept on my back like this. It's much
Okay.
better. If I turn on my right or on my left, on my left, it really didn't give me any trouble, but on my right side, it gave me some trouble.
It did, okay.
Yeah. So I mostly like slept on my back, and
Okay.
it was okay. Like using
And-
1 pillow.
And a lot of people ask me this, what's the best way to sleep on your back is the best way to sleep.
Yeah.
For everyone.
If you have hernia,
Or no, just for everyone.
for everyone?
For everyone, yeah. Sleeping on your back is the best way. Side sleeping would be second. There's only 3 options, that or on your stomach. Stomach is the worst side. There are some pillows and stuff you can use to improve a side lying or side sleeping posture, but sleeping on your back is ideal with a good ergonomic pillow with some support under the middle part of the neck. We're not going to go into that here, but we're going to go ahead and start with the hiatal hernia maneuver today. So I'm going to have you lay on your back, okay? So about a 40% improvement in the burping and the belching, and no acid reflux, but you only get that at night anyway, right?
Yeah.
Yeah.
Right.
And slide your shirt up. And the breathing, you said that it was the same as before. So meaning it hasn't changed, your breathing?
Let me explain this way. After first day treatment, my breathing was much better.
Okay.
Second day, when I got up second day in the morning, it turned to, regular breathing. And
Which was difficult.
it was difficult.
Difficulty
And
breathing.
this morning, it's just same as yesterday. So,
Okay.
Yeah, the breathing is pretty much the same.
Okay. So for those of you that didn't hear it, a lot of improvement in his breathing after the first visit. Not as much after the second.
Yes. So
And breathe in and out. And for those of you wondering, I'm probably using about 10 pounds of pressure. I gradually build up to that. Wouldn't you say it's about 10 pounds? Or would you say it's a little more?
At least 10.
At least 10, okay.
Yeah.
So, again, I'm putting the finger under the rib. I'm using my thumb. This is a technique I prefer to do. And we're going to catch the bottom of that stomach. And then once I grab onto it, sometimes he'll hear gurgling.
Yeah.
I'll then scoop it down and pull it down. And yesterday we put the microphone near your stomach, right?
Yeah.
We can try that one more time. People can hear that.
Yeah,
It's raining so hard outside. You might have heard a little bit of gurgling right there. And one more here, Eric. How you doing? Okay?
I'm doing okay for now. A lot of gurgling inside.
Yes, and I'm sure you folks heard that. I put the microphone right next to him, so you could hear that. And now we're doing it in a little bit of reverse order. We're going to adjust his spine now, and then you just relax there, okay? I'm specifically looking for subluxations at C3 through C5 for him. The vagus nerve does run up here alongside the spine at this level. Relax here. It is a cranial nerve, so. And now we're going to check T6 through T9, which is the nerve innervation to the stomach and the diaphragm. So on your belly. And we've gone over some of the stuff you need to do with posture, right?
Yeah.
So you have some, you're going back to Boston today, correct?
That's correct.
Okay,
yeah,
so
after 3 days.
we're going to give you some exercises to work on there, okay? And then I'm going to send you home with a self-help tool to help do what I just did with you on your back, pulling the stomach down out of the diaphragm, okay? And just relax yourself here. Take a deep breath in and blow all the way out. Relax your shoulders and back. Good. Okay. Because the self-help tool is not out yet, we're not going to film that just yet. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.